It begins silently. You might think skipping a day or two of proper hygiene is harmless, perhaps just a momentary issue of odor. But the reality occurring underneath the foreskin is far more aggressive and rapid than most men realize. That white substance referenced in the thumbnail? That isn't simply dirt or external debris. It is a rapidly accumulating biological paste known as smegma. Here is the harsh truth. The environment between the glands and the foreskin is the body's perfect incubator. It is dark, it is warm, and it is moist. When you stop washing correctly, you aren't just becoming unclean. You are actively constructing a petri dish on the most sensitive part of your anatomy. Within hours, the natural balance shifts and the microscopic landscape changes entirely. This is not a lecture on vanity. This is a breakdown of a severe biological chain reaction. We are going to track exactly what happens to your penis, hour by hour and week by week. We will explain how simple neglect evolves from mild discomfort into severe bacterial colonization, leading to inflammation, permanent scarring, and conditions that can eventually require surgical intervention. Because what builds up fast can cause damage that lasts forever. Let's analyze the biology of the first 48 hours. Let's look strictly at the biology of the first 24 to 48 hours. To understand the damage, you first have to understand the substance causing it. Smegma is often misunderstood as simply being dirt or external grime, but it is actually an internal secretion. It is a combination of shed epithelial cells, which are dead skin cells, and sebum, the natural oils produced by the Tyson's glands located around the corona of the glands. In a healthy scenario, this secretion serves a purpose. It provides lubrication between the foreskin and the glands. However, the anatomy of an uncircumcised penis presents a unique challenge. Unlike the skin on your arm, which sheds dead cells into the air, the skin under the foreskin sheds cells into a closed, confined space. This area is known as the preputial sac. When you stop washing, these dead cells have nowhere to go. They mix with the oils and moisture from sweat and urine droplets. Within the first day, this mixture begins to coagulate. It transforms from a microscopic layer into a visible, white, or yellowish cheesy paste. While this sounds unpleasant, the texture is not the main problem. The problem is that this paste is essentially high-grade fuel for bacteria. Your skin has a natural microbiome, a community of bacteria that lives on you harmlessly. However, the environment under the foreskin creates what we call a perfect storm. It is dark, it is warm, and it keeps moisture trapped against the skin. When smegma accumulates, it changes the pH balance of that environment. Within 48 hours, the healthy bacteria that usually protect the skin begin to be outnumbered. They are replaced by an overgrowth of bacteria that thrive in this protein-rich, oxygen-poor environment. This includes species like smegmatous bacteria and various fungi. This is where the smell comes from. The odor associated with poor hygiene isn't the smegma itself, it is the metabolic waste products, the gases and fatty acids, released by the bacteria as they feast on the buildup. By the end of day 2, you haven't just accumulated debris, you have created a thriving bacterial colony right against your mucous membranes. This layer now acts as a physical barrier, trapping heat and preventing the skin underneath from breathing. The glands is not regular skin, it is a mucous membrane, similar to the inside of your mouth or eyelid. It is highly absorbent and extremely sensitive to chemical changes. As we move past the 48-hour mark, this bacterial paste becomes acidic. It stops being a lubricant and starts acting as a chemical irritant. The body realizes there is an invader, and the immune system begins to wake up. This is the tipping point where we move from a hygiene issue to a medical issue. Once the bacterial colony has established dominance and the pH level drops, your body enters the inflammatory phase. In medical terms, we call this the red zone because the visual signs become unmistakable. You are no longer dealing with a passive layer of buildup. You are dealing with an active infection of the skin barrier. The first medical condition to set in is usually balanitis. This is the clinical term for inflammation of the glans penis, the head itself. Simultaneously, the inner lining of the foreskin, which is in direct contact with the infected smegma, also becomes inflamed. This is called postitis. Because these two surfaces are constantly touching, it is extremely rare to have one without the other. In the vast majority of hygiene-related cases, what we see is balanoposthitis, inflammation of both the glands and the foreskin. The mechanism here is essentially a chemical burn. As mentioned, the accumulated smegma traps droplets of urine. Fresh urine is sterile, but when it sits in a warm environment and is broken down by bacteria, it decomposes into ammonia. Ammonia is a caustic substance. Think about how ammonia is used in strong household cleaners. Now imagine that substance held against the most sensitive mucous membrane on your body 24 hours a day. The protective layer of the glands begins to erode. The skin turns a shiny, angry red. This is not a subtle pink hue. It looks raw and irritated. The sensation shifts from a mild itch to a persistent, stinging burn. You will likely notice this most intensely when you urinate, as the salt in the urine hits the raw, inflamed skin that has been stripped of its natural oils. But the irritation goes deeper than just the surface. The body sends a rush of blood and immune cells to the area to fight the bacterial invasion, causing significant swelling or edema. The tissue of the foreskin becomes boggy and thickened. This brings us to a critical functional problem. Retraction becomes difficult. Under normal circumstances, the foreskin glides easily back and forth. However, when the tissue is swollen and inflamed, it loses its elasticity. It becomes tight and painful to pull back. This creates a dangerous feedback loop. Because it hurts to retract the foreskin, you are less likely to pull it back to clean it. Because you don't clean it, the smegma continues to build up. Because the smegma builds up, the infection gets worse and the swelling increases. At this stage, you might also see a discharge that isn't smegma. The body may start producing pus as white blood cells fight the bacteria. The area becomes tender to the touch, making sexual activity or even the friction of underwear unbearable. The itch becomes maddening, an internal itch that scratching doesn't relieve because the source of the irritation is chemical and deep within the tissue. If you ignore the problem at this stage, thinking it will just go away on its own, you are making a critical error. The inflammation is not just a temporary annoyance, it is actively damaging the structural integrity of the skin. The body is trying to heal the damage, but in the presence of chronic inflammation, the healing process itself becomes the enemy. This takes us from a temporary infection to permanent structural changes. This brings us to the long-term consequences, where we move from conditions that are painful to conditions that are potentially irreversible without surgery. If the cycle of poor hygiene and inflammation continues unchecked for months or years, the anatomy of the penis begins to change permanently. This is driven by a process called fibrosis. When the foreskin is constantly inflamed, stuck in that cycle of swelling and bacterial attack we just discussed, the body attempts to repair the damage by laying down collagen. However, it does not repair the skin with the same elastic, stretchy tissue that was there before. Instead, it repairs it with scar tissue. Scar tissue is rigid, it does not stretch. As this microscopic scarring builds up, the opening of the foreskin begins to narrow and harden. This condition is called pathological phimosis. It is crucial to distinguish this from the tightness some men are born with. This is an acquired condition caused entirely by chronic infection and trauma. The foreskin essentially turns into a rigid, constricting ring that cannot be pulled back over the glands, even when flaccid. This creates a catastrophic biological trap. You now have a situation where the smegma, the bacteria, and the urine are sealed inside. You physically cannot retract the skin to clean the area, which means the infection can never be fully resolved. It becomes a self-sustaining anaerobic chamber. The pressure builds up inside, causing pain during erections and difficulties with urination. In severe cases, the urine balloons the foreskin out before dribbling away, a sign that the exit path is critically obstructed. The danger here isn't limited to the skin. When bacteria are trapped in such high concentrations at the tip of the urethra, they often don't stay there. They migrate. This can lead to ascending urinary tract infections. The bacteria travel up the urethra to the bladder, causing cystitis, and in rare but severe cases, can continue up the ureters to infect the kidneys, a condition known as pyelonephritis, which is a systemic life-threatening emergency. But there is a darker shadow that looms over long-term hygiene neglect, and that is the risk of penile cancer. We need to be very precise with the science here. For a long time, it was believed that smegma itself was directly carcinogenic. Modern research suggests it is a bit more complex than that. Smegma itself isn't a carcinogen like tobacco smoke, but the effect it has on the body creates the perfect environment for cancer to develop. Chronic inflammation is a known driver of cancer in many parts of the body. When the cells of the glands and foreskin are constantly being damaged by acidic bacterial waste and constantly trying to repair themselves, the rate of cell turnover increases massively. Every time cells divide rapidly to repair damage, there is a risk of genetic error. Over years of chronic irritation, these errors can accumulate, leading to squamous cell carcinoma. Furthermore, this buildup creates a hiding place for the human papillomavirus, or HPV. If you have been exposed to high-risk strains of HPV, and you have a foreskin that is never cleaned and constantly inflamed, the virus is far more likely to persist and cause cellular changes. The statistics are stark. Penile cancer is virtually non-existent in men who practice proper hygiene and can retract their foreskin, but the risk rises significantly in cases of phimosis where hygiene is impossible. At this stage, simple washing is often no longer an option because the anatomy has fused or tightened. The solution usually shifts from a washcloth to a scalpel, requiring a dorsal slit or a full circumcision to excise the diseased tissue and free the glands. Neglect has taken a bodily function meant to be simple and turned it into a surgical necessity. While avoiding surgery and keeping the exterior clean is vital, true penile health is also about what happens inside. If you are noticing that your erections aren't as full or firm as they used to be, that is often due to a hidden boner killer enzyme that pills only temporarily mask. I want you to see a presentation on a bizarrely simple 7-second daily habit, a natural purple tonic that targets the root cause of dysfunction to regenerate tissue and restore rock-hard vitality without side effects. Scan the QR code appearing on your screen right now to watch the full video explaining how this works. I have also pinned the link at the top of the comments section below. Don't ignore the internal signs. Now, returning to the external maintenance. Now that we have outlined the severity of the hygiene problem, we need to focus on the correct clinical protocol. Now that we have outlined the severity of the problem, we need to focus on the correct clinical protocol for hygiene. The goal here is to maintain the health of the tissue without disrupting the natural microbiome. It is a delicate balance between cleaning effectively and not over-sterilizing, which can cause its own set of problems. If you are uncircumcised, the non-negotiable first step is retraction. This must be done gently. If you haven't washed properly in a while and the area feels tight, do not force it back rapidly, as this can cause microtears in the skin which serve as entry points for infection. Pull the foreskin back until the entire glans is exposed, and you can see the coronal sulcus, that is the groove underneath the head of the penis, where the majority of smegma accumulates. Once retracted, the most important variable is water temperature. A common mistake is using very hot water, thinking it sterilizes the area. This is incorrect and damaging. The glans is a mucous membrane, not a callus. Boiling hot water strips away the essential lipid barrier that keeps the skin hydrated. You should use lukewarm water. Next, we have to talk about soap, because this is where 90% of men go wrong. You should never use harsh, scented body washes, shower gels, or bar soaps directly on the glans or the inner foreskin. These products are designed for the tougher skin of your arms and legs. They often contain alcohol, heavy fragrances, and sulfates like sodium lauryl sulfate. When applied to the glans, they act as irritants that cause contact dermatitis. They strip away the natural oils so aggressively that the body responds by overproducing oil to compensate, leading to even more smegma buildup later. The medical recommendation is to use plain, warm water. The mechanical action of the water and your hand is usually sufficient to remove smegma. If you feel you must use a cleanser, choose a pH-neutral, non-soap cleanser, or an emollient cream designed specifically for sensitive skin or intimate hygiene. Apply it gently with your fingers. Never use a loofah, sponge, or washcloth, as the texture is too abrasive for this tissue and can harbor bacteria from previous showers. Pay specific attention to the coronal ridge. You need to physically, but gently, remove any white deposits. Simply letting water run over it is not enough. The smegma is sticky and hydrophobic, meaning it repels water. It requires mechanical friction from your fingertips to dislodge. After washing, there is a step that is almost universally ignored: drying. You must ensure the area is completely dry before you pull the foreskin back up. If you pull the foreskin forward while the glands is still wet, you are trapping moisture inside that warm, dark environment. This creates the ideal condition for Candida albicans yeast to grow. A fungal infection can be just as itchy and destructive as a bacterial one. Pat the area dry with a clean towel. Do not rub vigorously. Once the area is dry, you must pull the foreskin back forward to its natural resting position. Leaving it retracted for hours can lead to paraphimosis, where the foreskin gets stuck behind the head and cuts off blood flow. Finally, regarding frequency, once a day is sufficient. We see patients who become paranoid about hygiene and wash 3 or 4 times a day. This is counterproductive. Overwashing dries out the mucosa, causing it to crack and lose its natural defense mechanisms. Hygiene is about management, not eradication. Stick to a daily routine with the right technique, and the biological risks we discussed vanish almost immediately. To conclude, we need to address the 2 most dangerous myths that circulate regarding this topic, misconceptions that often lead men to ignore these warning signs until it is too late. The first and most prevalent myth is that the penis is a self-cleaning organ. This is biologically incorrect. There is often confusion here with female anatomy. The vagina has specific internal mechanisms to regulate its own flora and discharge. The penis does not. The foreskin is a mechanical covering, not a self-cleaning oven. It captures and holds debris. If you do not manually intervene to remove that debris, nature will not do it for you. Evolution provided the anatomy, but maintenance is a manual responsibility. The second myth is that cleaner means better, implying that if you scrub harder or use stronger soap, you are healthier. As we established, if your glands feel squeaky clean, tight, dry, and high friction, you have likely damaged the mucous membrane. A healthy glands should be hydrated and possess a natural lipid barrier. Aggressive sterilization is not hygiene. It is tissue damage. Let's summarize the timeline one last time to ensure this is clear. It begins silently with smegma, a mix of oil and dead skin. If ignored, within 48 hours, it becomes a bacterial breeding ground. Within days to weeks, this acidity causes chemical burns, leading to balanitis and inflammation. If this becomes your chronic baseline, the body responds with scar tissue, leading to phimosis, the inability to retract the foreskin, and a statistically higher risk of penile cancer. The takeaway is simple: your health is cumulative. The extensive medical complications we discussed, from infections to surgery, are rarely caused by a single event. They are the result of hundreds of days of small instances of neglect compounded over time. It takes less than 60 seconds in the shower to prevent a lifetime of irreversible damage. Do not wait for pain to signal a problem. By the time you feel it, the biological breakdown is already well underway. Adopt the protocol, protect the tissue, and maintain your health.